Welcome to vpod.ai and to another deep dive designed just for you. Today, we're plunging into a condition that might sound pretty complex, but it actually impacts millions of people. It's chronic venous insufficiency, or CVI.
That's right.
You might have heard it mentioned recently, actually. A high-profile diagnosis involving a 79-year-old brought CVI into the public conversation, really shining a light on how common this is.
It really is. It's an area of health that, a lot of people live with, sometimes without even realizing it. Understanding it is key.
Absolutely. So our mission today is to unpack what CVI actually is, why it happens, who's most at risk, and critically, what can be done about it. It's a deep dive into, reclaiming some control over your vascular health. Let's get started.
Okay, so at its core, chronic venous insufficiency, CVI, it's a disorder where the veins in your legs, they struggle to efficiently send blood back up towards your heart. Think of your veins like a series of one-way streets. And along these streets are tiny valves, sort of like little traffic cops. They're meant to keep blood flowing only upwards, against gravity.
So if those traffic cops, those one-way valves, if they stop working right, or the road itself, the vein wall, starts to weaken, what happens then?
Exactly. That's the problem. When those vein walls get weaker or the valves don't close properly, blood can actually flow backwards.
Right.
It starts to pool in your lower legs, your ankles.
Ah, okay.
And this pooling, it leads to extra fluid where it shouldn't be. That's why legs can get swollen, discolored, even tender. It's literally a backup in the system.
That makes so much sense when you put it like that, a backup. And it sounds incredibly common. Just how many people are we talking about here?
It is incredibly common, maybe surprisingly so. Estimates suggest around 40% of women and maybe 17% of men suffer from CVI.
40% of women. Wow.
Yes. But to put that in perspective, CVI is actually more prevalent than coronary artery disease or even peripheral artery disease.
More common than heart disease, really. Yeah.
In terms of prevalence, yes. And what's really striking is how many people sort of brush off the early signs, like varicose veins, thinking they're just, cosmetic, when often they're the body's first signal of a real underlying vascular issue. Overall, CVI affects about maybe 1 in 20 adults.
Okay.
And about 1 in 3 adults have varicose veins. Each year, roughly 1 in 50 adults who already have varicose veins will go on to develop CVI itself.
So those varicose veins can be a stepping stone.
They can be, and it typically affects people over age 50, with the risk definitely increasing as we get older.
Right, that makes sense. So knowing it's so widespread, what makes someone more susceptible? Who is most likely to develop CVI?
Well, like we just said, age is a big one. Individuals over 50, and especially over 70, are at higher risk simply because vein walls naturally weaken over time. They become less efficient.
Okay. And I imagine certain jobs or daily routines could play a role.
Yeah.
Like standing all day or sitting all day.
Absolutely. That's a huge factor. People whose jobs require really long periods of either sitting or standing. Think about office workers, factory line workers, baristas, teachers.
Yeah, I can picture that.
They're at increased risk. The lack of movement or just that constant static pressure, it really challenges the veins. A simple recommendation there is just to try and change position for a few minutes every hour. If you stand a lot, try to briefly elevate your feet. If you sit, get up, walk around a bit.
Just break it up.
Exactly. I knew a teacher once who actually set an hourly reminder on her phone just to do some calf raises behind her desk. Little things help.
That's a great practical tip. What about weight? Is carrying extra weight a factor?
Oh, definitely. It's a significant factor. Being overweight or obese puts more stress on your entire vascular system. It forces your veins to work harder to pump that blood back up, and this extra strain makes it more likely that valves will malfunction, allowing blood to pool. It's just more pressure.
Gotcha. And I've heard family history matters too. Is there like a genetic link?
There absolutely is. Family history is a clear risk factor. Scientists have actually identified certain genes linked to weaker vein valves. So if CVI runs in your family, your risk is definitely higher.
Doesn't guarantee it, but nudges the odds.
Precisely. It's a predisposition.
And women seem to get it more often. Why is that?
Yes, women do tend to report higher rates of CVI. The exact reasons aren't, crystal clear, but hormonal changes play a big role. Things related to supplements, hormone replacement therapy, pregnancy, menopause, all these can affect the strength and elasticity of vein walls, making them more susceptible.
Okay. And lifestyle choices like smoking. Does that hit the veins hard?
Oh, significantly. Smoking's really bad for vein health and strength. The chemicals in tobacco damage the lining of blood vessels, weaken the walls. Smokers definitely have a much higher risk.
Right. And pregnancy. especially multiple pregnancies. That sounds like a lot of pressure.
It really is. Pregnancy adds extra pressure on the pelvic floor and the legs. You've got increased blood volume, the growing uterus. The risk of venous insufficiency does tend to go up with each additional pregnancy because of that cumulative pressure and the hormonal shifts involved.
So even if someone maintains a healthy weight, but they live a really sedentary life, are they still at risk? It seems movement is key.
That's a really good point. Yes. Lack of movement or even repetitive strain deeply impacts your chances. Our bodies need movement to help that circulation. And finally, maybe the most common cause is actually a history of deep vein thrombosis, or DVT.
Okay, DVT. How does that lead to CVI?
It's a critical link. When you have a blood clot from a DVT, it can leave behind scar tissue after it resolves. And that scar tissue can permanently damage those delicate vein valves.
So the damage remains.
Exactly. And CVI that develops specifically because of a past DVT, that's often called post-thrombotic syndrome. Other factors, less common but still important, include being tall simply because gravity has further to pull the blood down, and a condition called May-Thurner syndrome.
May-Thurner.
Yeah, it's an anatomical thing where an artery in the pelvis actually presses on a major vein, obstructing blood flow out of the leg.
Wow, it's fascinating how all these different factors can lead back to the same core issue with the veins not working right.
Yeah.
So if someone's listening now and maybe feeling a bit concerned, what are the key signs and symptoms they should look out for?
Well, the most common first sign is usually swelling, especially in the lower legs and the ankles. It often gets worse after you've been standing for a while or just towards the end of the day, when gravity's had its way.
Right.
You might also notice sensations like a dull aching or a feeling of heaviness, tiredness, maybe cramping in the legs, especially at night.
That heavy leg feeling.
Exactly. Some people get itching or tingling, that pins and needles sensation too.
And the pain doesn't, get worse or better with certain things.
It does. The pain typically worsens when you're standing up, but it often improves quite a bit, sometimes dramatically when you elevate your legs. That helps drain the pooled blood.
Makes sense.
And beyond just the feeling, there are often visible skin changes. You might see a sort of reddish-brown discoloration, usually near the ankles. Almost looks like a permanent rust stain.
A rust stain, wow.
Yeah, we call it hyperpigmentation or hemosiderin staining. It's literally tiny iron particles from red blood cells leaking out and depositing there.
Yeah.
The skin can also get flaky, itchy, irritated, maybe cracked. In more advanced stages, it might look kind of leathery or even thicken and harden. There's a medical term, lipodermatosclerosis.
Sounds uncomfortable.
It is. And of course, visible spider veins, or the larger varicose veins, those swollen, sometimes ropey veins, they can feel heavy or uncomfortable, even painful. They're common signs too.
And what about the really serious signs, things that point to a bigger problem?
In severe CVI, you can develop open sores or ulcers. We call them venous stasis ulcers. They usually appear near the ankles. These are notoriously slow to heal, unfortunately, and they can easily get infected, leading to something called cellulitis, which is a skin infection.
That sounds quite serious.
It can be. Other signs include scarred, whitish patches of skin, that's called atrophy blanche, and sometimes a fan-shaped pattern of tiny dilated veins around the ankles or feet, which we call corona phlebitica. You might also experience restless leg syndrome, that uncomfortable urge to move your legs, or painful leg cramps, muscle spasms, Charlie horses.
Right.
It's important to remember you probably won't have all these symptoms at once. They tend to progress over time. CVI is usually diagnosed formally at stage 3 or above, which means swelling is pretty much always present.
That sounds incredibly uncomfortable, potentially quite debilitating. So what's the outlook? What are the major complications if CVI is just ignored?
Well, CVI itself isn't generally considered life-threatening. However, ignoring it can definitely lead to serious complications. Those leg ulcers we mentioned are a big concern. They're tough to treat, and they often come back.
Oh, dear.
Other potential complications include developing new deep vein thrombosis and, importantly, pulmonary embolism. That happens if a DVT clot breaks off and travels to the lungs, and that is life-threatening.
Okay, so that's a major risk downstream from DVT.
Yes. Also, you can develop secondary lymphedema, which is swelling caused by damage to the lymphatic system from the chronic venous pressure.
So it's not static, this condition. It actually progresses.
Exactly. CVI is definitely a progressive disease, which, sounds a bit daunting, but it really highlights why getting diagnosed early and managing it consistently is so crucial.
Right. Which leads to the question, can it is reversed? Can you cure it?
Yeah, that's the key question, isn't it? Unfortunately, the actual damage to the vein valves, once it's happened, that can't be reversed or cured. The valves don't heal themselves. However, and this is the important part, treatment can significantly reduce the symptoms and really improve your quality of life.
So management is key. If someone is having these symptoms, how do doctors actually figure out if it's CVI? What's the diagnostic process like?
Diagnosis usually starts with a physical exam. The doctor will often want to examine you while you're standing up to really see the effects of gravity on your legs, and they'll take a detailed medical history, of course. But for a clear picture, they usually rely on an imaging test.
Is that where the duplex ultrasound comes in? I think I've heard of that.
Precisely. A duplex ultrasound is the key diagnostic tool here. It uses sound waves, it's non-invasive, it lets the doctor see the blood flowing through your veins, check the structure of the veins, and measure the speed and direction of blood flow in real time.
So they can actually see the backflow.
Exactly. They can pinpoint damaged valves, see where blood is pooling, and also check for other problems like blood clots. Doctors also need to rule out other conditions that might cause similar symptoms, like peripheral artery disease, PAD,
Okay.
because PA can actually coexist with CVI, and knowing if you have both is really important for treatment decisions, especially regarding compression therapy. They also use specialized tools. You don't need to memorize the names, but things like the CEAP classification and the Venous Clinical Severity Score, or VCSS.
Right.
These just provide a standardized way for doctors to classify exactly how severe the CVI is, which helps guide the treatment plan.
That's helpful. A clear system.
Yeah.
So once someone gets that diagnosis, what's next? What are the treatments, the management strategies?
Okay, so the main goals of treatment are pretty straightforward. Improve blood flow, reduce the pain and swelling, heal any ulcers if they're present, and generally improve the skin's appearance and your overall quality of life. And the very first line of defense almost always involves lifestyle changes.
Okay, what kind of changes are we talking about? Big stuff or smaller adjustments?
Many are surprisingly simple, but they can be profoundly impactful. Things like leg elevation, just lifting your legs above the level of your heart for maybe 30 minutes or longer, ideally 3 times a day or more, that really helps reduce pressure and swelling.
So don't gravity assist.
Exactly. And regular exercise, especially walking. Walking is fantastic because it strengthens your calf muscle pump. People often call the calf muscle the second heart for this reason.
The second heart, I like that.
Yeah. The muscle action literally pumps blood back up towards the heart. Even simple foot and ankle flexing exercises help.
So strengthening those calves is like supercharging your circulation from the ground up. Powerful.
It really is. Weight management is also vital, as we discussed. Losing excess weight takes a significant load off the vascular system. And going back to those risk factors, avoiding prolonged standing or sitting is key. If you're on a long car ride or flight, get up, move around, or at least flex your legs, feet, and ankles every half hour or so.
Good advice.
Also, avoiding tight clothing around your waist, groin, or legs, and maybe skipping the high heels, as those can restrict blood flow. And trying to cut back on excess sodium, salt in your diet helps reduce water retention and pressure.
And skincare sounds important too because of those skin changes you mentioned earlier.
Very much so. Moisturizing regularly helps prevent the skin from getting dry, flaky, or cracked, which lowers the risk of infection getting in. Good skin hygiene, washing gently, and moisturizing daily is highly recommended. Your doctor or nurse can suggest the best products to use.
Okay, so lifestyle is foundational. What's the main medical approach beyond that?
Compression therapy. This is really the mainstay, the cornerstone of CVI management. It works by helping blood flow upwards towards the heart, and it significantly reduces swelling and discomfort.
So the stockings.
Primarily, yes, compression stockings. They gently squeeze your legs. They're designed to be tighter at the ankle and gradually less tight as they go up the leg, and that gradient helps push blood upward. They come in all sorts of strengths, fabrics, lengths, even different designs. Some have zippers now to make them easier to put on. They can also be custom made if needed.
I've heard they can be a real challenge to get on sometimes.
Oh, they absolutely can be. I've heard stories, people breaking a sweat. But thankfully, there are aids now, like special silk sleeves you put on first, or devices called stocking butlers that can make it easier. The best time to put them on is first thing in the morning, ideally before you even get out of bed, or at least before swelling starts to build up.
Before gravity kicks in too much.
Exactly. And besides stockings, there are other options. Things like paste gauze boots, sometimes called Una's boots. A professional applies these and they're changed weekly. Or multi-layered wraps. There are also specialized Velcro adjustable compression bands. These are often inelastic or rigid, and they can be a good alternative for people who really struggle with stockings.
Right.
And for really severe swelling, or if someone has lean immobility, there are pneumatic compression pumps. These are inflatable sleeves for the leg that inflate and deflate sequentially to actively pump blood and fluid out.
Wow, okay. So compliance, sticking with the compression, that's really key then, even if it's a bit of a hassle.
Absolutely crucial. Consistent use of compression therapy is probably the single most important factor for success in managing symptoms. The constant pressure makes a huge difference. But one important caution. People who also have peripheral artery disease, PAD, need to be very careful. Compression might not be right for them, or they might need a lower level. Always check with your doctor first.
Good point. Are there medications that can help with CVI symptoms or the complications?
Yes, there are some. Antibiotics might be needed if there's a skin infection or an ulcer gets infected. Anticoagulants, blood thinners, are used to treat or prevent blood clots, especially if DVT is part of the picture. Sometimes aspirin is used to help ulcers heal. Interestingly, diuretics, water pills, are generally not the first choice for CVI swelling unless there's another reason like heart failure. Because the swelling isn't usually due to overall fluid overload, it's poor circulation dynamics.
I see. Okay, so what if these more conservative things, lifestyle, compression, aren't quite enough? Are there procedures to fix the damaged veins directly?
Yes, absolutely. There are several very effective, minimally invasive procedures available now, and these are usually safer, more convenient, and just as effective, if not more so, than traditional surgeries used to be. One common one is sclerotherapy.
Sclerotherapy.
Yeah, it involves injecting a solution, could be salt water, a special chemical, or even a foam directly into those problematic spider veins or smaller varicose veins. It irritates the vein lining, causing it to collapse and eventually fade away.
So it closes them off.
Exactly. Then there's endovenous thermal ablation. This uses heat either from a laser or from radiofrequency energy delivered through a thin catheter inserted right into the diseased vein. The heat seals the vein shut from the inside.
Okay, sealing it off again.
Right. Another method is the Venous closure system. This uses a special medical-grade adhesive, like a glue, injected into the vein to seal it closed. The body then gradually absorbs the sealed vein.
Medical glue. Fascinating.
It is. And for varicose veins that are closer to the surface, doctors might do a microincision or ambulatory phlebectomy. This involves making tiny cuts or needle punctures in the skin to physically remove the problem vein segments.
Okay.
And for specific types of problem veins called perforator veins, these connect the superficial and deep systems, there's a procedure called subfascial endoscopic perforator surgery, or SEPS. It uses tiny instruments and clips to block off these damaged connections, usually above the ankle.
Lots of minimally invasive options then. What about actual surgery? Is that still done?
It's less common now, reserved for more severe cases where the other methods might not be suitable. But yes, surgery is still an option. This could include ligation and stripping. That means tying off the main problem vein, the ligation part, and then physically removing longer segments of it, the stripping part.
Okay.
Or, in very complex situations, a vein bypass might be done. Similar to a heart bypass, they use a healthy vein taken from elsewhere in your body to reroute blood flow around a badly damaged or blocked vein segment. And for certain blockages in the deep veins, sometimes a procedure called percutaneous transluminal venoplasty and stenting is used. That involves using a balloon to open the blocked vein and placing a small metal tube, a stent, to keep it open, like plumbing for veins.
Wait, like a stent for the heart, but in the leg vein.
Exactly. Wow.
Okay, this has been an incredibly thorough look at chronic venous insufficiency. So pulling it all together, what does this mean for someone living with CVI or maybe worried they might be developing it?
Well, I think the main takeaway is, while CVI itself, the valve damage, can't be reversed or cured, it's absolutely crucial to understand that the symptoms can be managed effectively. Your quality of life can be significantly improved with the right combination of lifestyle changes and medical treatments. Consistent effort really pays off.
And it really sounds like doing nothing is the absolute worst option here.
It truly is. The worst thing you can do for CVI is ignore it. Getting an early diagnosis and working with a healthcare professional to get a tailored treatment plan, that is absolutely key to feeling better and preventing those potentially serious, debilitating complications down the road.
It's just remarkable, isn't it, how much impact our daily habits, even simple muscle movements, can have on our long-term health. You know, given that our calf muscles can literally act as a second heart to help overcome this venous insufficiency, it makes you wonder, what other seemingly simple daily movements might be silently helping or hindering our long-term health in ways we haven't even considered yet? Something to think about.